already know this by having friends or family members. I know I have the flu widespread here in South Carolina, and according to DHEC, there have actually been more than 8,600 confirmed cases. Ones they actually know of, folks who have gone into a doctor's office to get a test since the flu season began, and it only began back on October 2nd. So the CDC does track the virus nationwide, and this is the latest map that shows that the Palmetto State is actually, look at that, among the hardest hit. We're in blue in the country. We are one of only 3 states that are colored that purpley blue color that represents the very highest flu numbers across the country. And then looking a little closer at South Carolina, let's take a look and pull this up here. Here is the same map. Let me just step back a little bit so that you can see the blue, the maroon colors going into the red, very high. And now look here in the Midlands, ranking very high for our portion here of the state. Same is true for the Greenville area in the upstate and in the low country, again, where we know we have lots of students at Citadel and College of Charleston as well. Flu numbers very high down there in the low country as well.
Andrea, packed rooms with bad cases of the flu. That's how one doctor in Saluda is describing his hospital over the last month. News 19's Nate Stanley has the message healthcare providers want you to hear.
Behind the doors of Lexington Medical Center Saluda Point Urgent Care, Dr. Evan Dingle is seeing the worst flu season of his career.
We've had to call in extra doctors. We're having to work extra shifts to deal with the huge influx in volume we're seeing.
With Lexington Medical Center averaging 225 positive flu cases a day at its urgent cares, Dingle says this is something impacting the entire Midlands community.
The flu definitely does not discriminate. We see anywhere from newborn babies to I saw someone older than 90 in the last few days with the flu.
This is the case for much of the state, according to Dr. Jonathan Kanuka from DHEC.
We have over 8,600 cases, confirmed cases of flu so far this year. At this point last year, we had about 50. We also have over 400 hospitalizations this year. Last year, we had just around 10.
Dr. Helmut Albrecht from Prisma Health says the hospital system is also being strained by the early start to flu season. He adds the way to curb this sharp increase is by following the basics.
Just don't go to school. Don't send your kids to school when they're sick. Get them vaccinated and we'll get through this.
According to Kanuka, with the holidays around the corner, right now is the time to get the flu shot in order to protect you and your family members.
We really want people to get their flu shots and their COVID shots now before they travel for the holidays, because it will take a couple weeks for their body to mount the full response and really offer protection for themselves and for people around them. So now is the time to do it, not to wait to the last minute.
In Columbia, Nate Stanley, News 19, WLTX.
DHEC adds that it typically takes up to 14 days after your flu shot to be considered protected from the virus.